Assalamu alaikum. We will just try to have a look on the how to plan our anesthesia and just how to look into different various surgeries. So it's a relatively neglected topic, but there are so many things which you can learn even if you are thinking about procedure DNC and ENC. First of all, there is a small difference between DNC and ENC. In ENC, there is evacuation, and DNC there is dilatation. So I actually this is more of terminologies, but usually evacuation and curettage usually after missed portion, the procedure which is being done is ENC, and DNC can be a little. You can say it's a sort of synonym. So the concern you should be thinking is a lithotomy position, and even the complication which can occur after. So as I have mentioned here, nerve injuries and position related injuries with reference to lithotomy. Not only that one, and actually something which has occurred during the delivery, and that can also, like when you have given a party in that procedure later on, so it can become a responsibility for you as well. So you should be knowing about it. Then this functional uterine bleeding, so they are doing it a number of times as a diagnostic tool. Okay, so they want to do a biopsy. Okay, and sometimes this curate can be therapeutic as well. So either it is diagnostic, therapeutic, or as a procedure, as a mandatory. Even say there is retained product of conception. So I will try to cover both aspects. There may be some bleeding disorder, like there is dysfunctional uterine bleeding leading the patient to be any to have anemia, but underlying maybe there is a bleeding disorder. So if you are planning any anesthesia, you should think about it, that if you are choosing regional anesthesia, for instance, spinal or whatever, like saddle block. Some people think that saddle block can cover it, but unfortunately, saddle block will not cover, because the perineal part it will be covering, but because they will be entering in the uterus, so the patient will be in discomfort. So always consider these things in your mind. And then hormone replacement therapy, and the chances of thromboembolism. Actually, I should write it here, because that patient will be at more risk of thromboembolism. Okay. This is one more thing which you should be thinking. Then stress dose steroid if the patient is on chronic steroids. Cancer concern. This may be a cancer patient. Okay, and that is presented as a DUB. So you should be thinking about it. And the comorbidities according to the age, which can be there in older age group. Now some points with reference to DNC, ENC, which we are frequently doing, whether it is a retained product of consumption, missed abortion, or sometimes they are also bringing it. It's a slightly different one, but episiotomy tear or repair of it is will have almost the same concern. So pregnancy changes, effect, and how to manage. Like that, this is a thing which we people are reading about it. But we are missing something that you should be knowing. What is the change? Like for instance, there is a change in gastroparesis, like the gastric emptying. So there is gastroparesis. There is increase risk of increase like patient is full stomach, and on top of it there is difficult laryngoscopy, there is engorgement of airway, breast tissue is enlarged, and there is abdomen filled by the baby, so FRC is reduced. So all these are leading to difficult intubation and risk of aspiration. So this is the reason is the change is because of either the baby or progesterone, and this is affecting is risk of aspiration, difficult intubation. And how will you manage? You will pre-medicate, you will do rapid sequence pre-medicate, like acid prophylaxis. You will do ramp position, rapid airway management position. You will elevate the head side, and you will make the triggers at the level of stenomental angle. Okay, and you will be doing rapid sequence induction, you will be doing the pre-oxygenation. This is how, like this is the concept, that how you will be managing the pregnancy changes. So the patient may be hypovolemic because of bleeding, psychological concern with reference to not only the loss of baby. Okay, so this should be in your. And then some post-operative complication like uterine rupture can occur. So you have to be very careful in post-operative period, post DNC. If there is anything like that, any disproportionate pain or abdomen is tense, so you have to be careful about it. Then emergency surgery, there is a source aspiration. Any surgery in which vagal is involved, there may be bradycardia. Okay, so like I have just chalked out. So this is the best way to understand concern, how to extract the concern of the surgery, of the procedure. And if you just, because there will be overlapping, okay? So if you understand this concept of study, believe me, now the concept will be from where you will have to study. You can use any source, okay? At the end of the day, you should have make a very good tasty food. The whatever recipes you are using, anything can be there, but it will not be in one book. You have to think, you have to discuss. So you are welcome to ask any question to me anytime. Thank you very much.